If you're watching this video, that means you had an umbilical hernia repair or a ventral hernia repair, or your surgeon didn't give you good instructions, so you're checking us out. Today we're talking about ventral hernia repair. Ventral hernia, umbilical hernia, same thing. Usually there's a laparoscopic port. Just watch that for redness, or if it separates, give us a call. The majority of the pain that you're going to have is where your ventral hernia or umbilical hernia was. This is because we go in, put stitches to hold this together. You cannot lift anything heavier than 25 pounds. If you lift anything heavier than 25 pounds, you will tear those sutures. If you smoke, it may not heal, so we recommend you decrease the amount of smoking about 4 weeks before surgery as well as 4 weeks after surgery. Putting ice on it will help a little bit, but not as much as it would if you had an inguinal hernia repair. What you really want to watch for is swelling or redness at the area. The other thing you got to watch out for is significant tenderness. Patients that have mesh repairs will have a little more tenderness than someone that doesn't have a mesh repair. The issue with a mesh repair is it can get infected, or if you had previous surgery and we had to take down a lot of adhesions, you're also at risk for an infection. Watch out for significant abdominal pain. Your pain should get better each day, not worse. If it's getting worse, give us a call. If you're seeing redness at the incisions, give us a call. You pretty much can shower with all of these incisions afterwards because they have dermabond on them. It's basically super glue that waterproofs the incision. Pretty much it. Watch out for redness, erythema, something like that. Give us a call. I'll put a list of things you need to watch out for after surgery, just to make sure that you're doing okay. And realistically, if you have any questions, give us a call. We'll get you taken care of. Again, thanks for letting us operate on you and rocking with us. We appreciate it. Take care.